talk to Dr. Margaret Harris from the World Health Organization. Dr. Harris, welcome to the programme. Are we close to the end of this pandemic?
Good afternoon. We're still very much in it. Those figures you just gave are an indicator. And indeed, I mean, in the last week, we saw 980,000 new cases globally. And we know that it's an underreporting because many countries are not testing the way they were. Sadly, we lost 5,800 people last week, and we continue to see those high numbers of deaths. Now, the good news is, yes, the numbers have come down, but it's not good news if you are one of those people suffering. And we are actually seeing a rise in some European countries. So, for instance, in Eastern Europe particularly, we did see a rise in cases. And overall in Europe, we saw a 12% rise in the last month. So we're certainly not at the end of it. But as you mentioned, we're in a better place because of the use of vaccination and better treatment.
3 years on, what have we learned? Have we learned any lessons from coronavirus?
We've learned when we work together, we do very, very well. We worked very well together on vaccination. There was great transparency. There was great sharing of the information, sharing of the genome, which enabled the scientists right from nearly the first week to get on with the job, and continued sharing. What we haven't done so well, and what we need to do far better, is to share. I said we were sharing information, but to share what we create. So sharing those tools. Once we got the vaccines, once we got the treatments, even the protective equipment, the countries with the greatest resources and power tended to keep that, and it was a real struggle to get those tools out. We still have 8 of our WHO member states who've vaccinated less than 10% of their population. And worldwide, the high-risk people, older people, we're still seeing only 49% of those people have been vaccinated in lower-income countries. So we've got a lot more work to do.
What did the WHO get right, and what did the WHO get wrong?
We got right the getting people together. We got right the information as we understood it. We got right the talking to the world as often and as openly as possible. What we all got wrong was we weren't necessarily right about what we knew and didn't know about the virus. We all need to be better at accepting that when you've got something completely new, you have to keep your mind very open, and that was a struggle, I think, for everybody. The other thing we didn't do as well as we would like to have done, as I said before, is to really get the world to share. The tools won't work unless everybody's got it, and we weren't able as the world to get those tools to everybody.
There are raging debates about lockdown around the world. Did lockdown work?
So lockdown was always something I think the WHO was never keen on, because it's got enormous economic and social consequences. And what we were saying was take all the other measures that we know should prevent the virus raging through your population out of control, so that that doesn't happen. You don't have to get to a stage where the only thing you can do is put your population into quarantine. So that's what a lot of authorities ended up doing. A lockdown is simply putting the entire population into quarantine. But there were many things you could do before, and particularly the testing, the isolation, the tracking of people who actually had the virus, and getting people who are at highest risk protected. A lot more of that had to happen more quickly.
Dr. Harris, good to talk to you. Thanks ever so much for coming on the programme. Dr. Margaret Harris from the World Health Organization.